Hey guys, it's Dr. Roberts. Welcome back to the channel with Ultimate Bariatrics. Today we're going to be talking about how to avoid dehydration after surgery. I want to take a second to apologize for the delay. I know it's been a little while since I got anything out. I've just been real busy lately. So I'm just going to dive right into it. Dehydration is one of the most common reasons why people end up back in the emergency room or perhaps admitted to the hospital. And so I'm going to go over kind of some basic steps on how to minimize that risk. So dehydration is one of those things that can potentially be avoided if you can stay ahead of it. There's a lot of different reasons people get dehydrated after surgery. And so the first thing that we need to address is just start and focus on hydration. I know it's easy to get distracted by, well, how much protein am I getting, and is my vitamin levels going to be bad, and am I getting enough nutrition? But in the acute phase after surgery, the first 5 to 10 days, really hydration is by far the most important thing. So what I typically recommend is to just basically plan on having something to drink 24/7. You want to be just sipping on something all the time. You should either be sipping on a liquid or waiting to drink a protein drink or waiting to start sipping on your liquid again. I think water is probably ideal. Crystal Light or something sugar-free is also fine. And there are some cases in which maybe even a drink with some sugar in it is probably better. And I'll go into that in a minute. So the typical routine that I recommend is just wake up in the morning and drink your protein drink. And the way that you should address your protein drink is to just sip on it. And you should sip on it until you feel full. If it's the first few days after surgery, you're probably going to feel full pretty quickly. You probably won't be able to finish the whole thing. It's not something that you should force. You shouldn't try to get it all down. You should just sip on it very slowly until you feel full. If you can finish the whole thing, then that's fine. Then just stop. And if 30 minutes or so goes by and you're still sipping on the liquid, that's time to stop. Then after that, I want you to kind of wait 30 minutes and then start sipping on whatever your beverage is for hydration. If it's Crystal Light, if it's water, if it's sugar-free Powerade, whatever you choose to do. I want you to just sip on that until it's about 30 minutes until your next protein drink. And that's kind of the cycle. You wait 30 minutes, drink your protein drink for 30 minutes, wait another 30 minutes, then go back to sipping your liquids. When it's time for the next protein drink, give your stomach or your pouch 30 minutes or so to empty out. Then go back to sipping your protein drink, let the protein drink empty, and then go back to sipping your water. And that cycle just repeats itself all day, every day, unless you're asleep. That's a good way to stay on top of it. Usually, it's going to take a concerted effort and a diligent effort to meet your hydration goals. I generally recommend 48 ounces of water a day. Now, this is a general recommendation. Some people are going to get more, some people are going to get less. It doesn't mean that if you're going over that or if you're not quite getting there that something bad's going to happen. It's just a general guideline. And obviously, a taller, larger person is going to probably require more hydration than a smaller person. So these numbers can't be, perfect for everyone. So they're just general guidelines to go by. Another thing that can complicate this is nausea, and especially after the sleeve gastrectomy, nausea can be a problem. And a couple of things that you can do is, number one, take nausea medicine or call your surgeon and get some nausea medicine. At Ultimate Bariatrics, we routinely prescribe nausea medicine to have on hand after surgery. And this is something that can help you maintain your oral intake and your hydration by just medicating yourself. If you know that the pain medicine is giving you nauseated, take the nausea medicine preemptively before you take the pain medicine. That way that you know that you've medically tried to minimize the risk of having some nausea with the pain medicine. Sometimes these surgeries just cause nausea. Sometimes it's the anesthetic. Sometimes it's just you had surgery on your stomach and that causes nausea. So take the nausea medicine, and that will also help minimize things. What can happen in some cases is you have a little bit of nausea, so When you're nauseated, you're not going to want to take anything by mouth, and so that causes dehydration. Once you start to get dehydrated and you get nauseated from that, then it kind of becomes a vicious cycle where you're getting more dehydrated because you're nauseated, and as you get more dehydrated, you're continuing to become more significantly dehydrated, and this is how people typically end up in the emergency room with trouble. So one thing you can do to kind of break that cycle of nausea and dehydration is to try to drink something with a little bit of sugar in it. Whenever our bodies are depleted of carbohydrates, we make something called ketones that our body uses for energy. Ketones cause a lot of nausea and especially a lot of headaches. So if you find yourself having headaches and nausea after the surgery, one thing that works quite well is to just go ahead and go to the store and get some regular Gatorade or a regular sports drink that has a little bit of sugar in it and sip on that instead of water. And a lot of times that will make your headache get better, and that will make your nausea improve, and then you can take in more by mouth and avoid an unnecessary ER visit, or perhaps a visit to an IV fluid rehydration clinic. So that's one of the things that I find works very well for patients, is to cut the ketosis by drinking some sugar, which is probably counterintuitive and probably different than what you may have been explained to in your pre-op classes and your education prior to surgery. These things are not necessarily ideal for weight loss, but here we're trying to avoid an ER visit. So a little bit of sugar immediately after your surgery for a couple of days is not going to short circuit your weight loss in any way. So I wouldn't worry about a little bit of extra sugar. So that's one very important thing. The other thing is to just try like a sugar-free sports drink, like sugar-free Powerade. This is something that works quite well. The nice thing about sports drinks is because they have electrolytes in them, you get a little bit more hydration for less volume than you do with just regular water. So if maybe you're getting 40 ounces instead of 48 ounces, or 30 ounces of oral hydration instead of the 48, what you can do is, instead of doing water, you can do the sports drink, and then that will help you get a little bit more hydration out of that lesser volume of oral intake. So those are some of the key things that you can avoid unnecessary ER visit, and one way you can avoid dehydration, the addition of the sugar-free drinks. And then also, I think just staying on task with your regimen for your hydration and your protein intake. I think it's good to have a plan for after surgery, and it's also good before surgery to experiment around with a couple of the different clear protein drinks. In our practice, we recommend clear protein drinks for the first week after surgery. And so I would encourage you to try a couple of different ones. They're not quite as popular as the regular milk-based protein drinks, and so you may have to try a few different ones before you find one that you think that you're going to like enough. Because once you're already nauseated from surgery, the last thing you want to do is drink something that you don't really like the taste of. And we certainly don't want you getting nauseated and getting dehydrated simply because the taste of the protein drink is not really something that agrees with you. There's a lot of different options out there. I would encourage you to contact one of our dietitians if you're an Ultimate Bariatrics patient, and discuss with them perhaps the different varieties of clear protein drinks out there. This is another thing that you can do to help minimize trouble after surgery. So just to recap, if you start getting headaches and feeling dehydrated and are not quite meeting your hydration goals, try to drink Gatorade or a sports drink with a little bit of sugar in it. It's okay. The next thing that you can do is make sure you have a good plan, and make sure that you're cycling your protein and your oral intake, and giving your stomach or your pouch enough time to empty out before you're doing a protein drink or going back to your beverage for hydration. And then the last thing is to try just a sports drink without sugar, just to get a little bit more hydration out of your oral intake. So that's all I've got for you on this visit. Next time we'll talk about decision making and what to do if you feel like you're having trouble and are not able to manage postoperative dehydration, or perhaps are having another issue after surgery. We'll see you next time.